Good morning. Good morning to everyone, and welcome to the 100th session of the Cameroon Town Hall. Today, we don't have a guest speaker. We wanted to take this opportunity to have a reflection of the last 100 sessions of the Town Hall. Today marks the 100th time that we've had these meetings, and these meetings have occurred bi-weekly for the last since the peak of the pandemic in early 2020 to today. And the vision of the town hall initially was to bring together expertise, technical expertise, clinical expertise, public health expertise from across the globe in order to see what we could do to help with the public health response and the clinical response that came with the urgency of the COVID-19 pandemic. And since then, it has grown immensely in terms of the network of people who are involved and engaged in the town hall to several thousands of people, which has been pretty remarkable. So we wanted to take the occasion today to reflect a little bit about the history, to reflect a little bit about the story behind the town hall, and to have a sense of what a direction for success for the town hall would look like for the next few years. So thanks a lot for joining. We really deeply appreciate you all joining us today, and we really want to have this to be a discussion and to be a conversation between us all. So thanks all for your leadership, and we're looking forward to hearing as well from you all, hearing about some of the success things that you've learned from the town hall. Would love to hear about your thoughts about things that you've learned and how it's benefited you, and some ways that you think that the town hall, some strategic directions for the vision of the town hall. So thanks all for joining us. I also see that our chair, Dr. Mono Kena, is here as well. And I know you're very, very busy today, and I see you on a very magnificent, looks like a wedding dress, but welcome to the town hall.
Wow, thank you, Brian. I am presently in Hot Springs, just around Little Rock. This is my first time here in Arkansas. And my brother's wedding, it's my cousin, so his wedding today. And I just had to dash out of the first part of the wedding just to join the town hall, you know. It's always amazing to see that we've been doing this now for 3 years. And I cannot thank all the moderators more than we can ever think about, having you guys dedicate every fortnight to discuss relevant issues about healthcare in Cameroon, and also to see how we can build ourselves and get to solve problems. So, Brian, you know, to me, what I take out of this is that if I could back out of this project, I would have. But day after day, I see new faces, I see new people join, and I see a different level of interest and enthusiasm in the whole healthcare system in Cameroon. I think there is a drive internally and in the diaspora that we want to make things better. We want to collaborate with those back home. We want to be facilitators. We also want to hold the administration accountable, and they also want to be held accountable in what is going on in healthcare. And healthcare is one of those issues in the world where the economics of health is different than other kinds of economics. While you're driving it by demand and supply, but in healthcare, you need to take into account equity. How do we make sure that the guy who is in Twerere, who is in Yoka, who is in Gomenduka, who is in Mada, who is in, those are all places I went to at times, who is somewhere in Womb, somewhere in Jikwa, has the same health access as someone who is in Yaoundé, Bonapriso, Bonanjo, and going to l'Hôpital General. how do we make that possible back home in Cameroon? What contributions can we give? And I think there is a lot that can come from the diaspora. I also think that there is a lot the diaspora can learn from public health specialists back home. And the diaspora includes everyone, those who can help financially, those who can help in terms of human resource, those who can help in terms of building infrastructure back home, those who can give both their savoir faire and be able to influence things back home, those who have a good savoir edge and can be able to influence those who rule us. So, Brian, I'm looking forward to this discussion, and I think it's going to be a fruitful one. Just that I've been distracted, as I told you, but I'm here. I never knew I was going to make it here. So this was going to be the first time I'm missing the town hall in about 3 to 4 years, despite my busy schedule, but I still made it. So
yeah, thanks a lot for those opening remarks, Mona, and thanks a lot for your leadership and also for the vision and also your tenacity and really your goal and drive to see the expertise and the diaspora being leveraged to improve healthcare. I really wanted to come back to the beginning when you had this vision. What you really had in mind when you were envisioning this whole idea, this whole project of giving back to Cameroon. And if you could take us back to those early days, Dr. Mono, when you were seeing so many patients with COVID-19 dying at the Richmond Medical in New York City. Just take us a little bit back to what you were seeing during those times and how some of the lessons you took away from that experience and how it changed your perception of medicine and also public health and how that could benefit the country.
Yeah, so Brian, I think public health is a very strong weapon, even when you're a clinician. So my background, I did clinical medicine in Cameroon. I also specialized in Cameroon in clinical pathology before moving to the US, and I did a master's in public health. So when the pandemic hit, I was just finishing my internal medicine and starting oncology. When the pandemic hit, what I realized was that even those who were here in New York, I can tell you February, March was the month we never understood what was happening. We had a disease. We didn't know if it was droplet-borne, airborne, how was it being transmitted? And in a space of 2 weeks, our hospitals became saturated. And we had no real weapons to fight against this. And I saw how the US healthcare system, especially in New York City, went on its knees. And we had a strong governor at the time who did his best in order for us to get assistance in terms of what we needed to take care of these patients. As time went on, we started discovering things that could work. My thought process was, if this hits Cameroon, Africa, how do we leverage all the things we're learning and be able to make those who are back home aware of the information we're getting, make them aware of how serious this is, and make sure that everyone knows no one is going to be spared at the end of the day, that this is kind of a pandemic. I spoke with a lot of veterans. I have some few in my hospitals who are doctors, who are in their 70s. And what we saw in New York is what they had not even seen in Vietnam. Neither had they seen it in the World War I or II. So this was very scary in terms of the number of patients, the number of deaths, the number of people who were dying, and we didn't really have a lot of solutions. And some young people were dying too, and we also thought we're not going to make it. So the goal was to create a platform where we could share knowledge, discuss with those who are back home what we think is working, and try to influence the management and keep everyone up to date with what is happening with COVID. So, Brian, that's what led to this whole adventure that is keeping us here up to, this is the 100th episode of this. So we've been doing this for 200 weeks, if you can say that, so, or more. So this is amazing. You're muted, Brian.
Yeah, thanks a lot for sharing those reflections. I do remember vividly those really scary times in 2020, and how scared people were really at the time, because we just didn't know much about the disease. But I also think that it reminded us about how important uh, public health is, and how important it is for us to work with other nations, and the importance of that, and also recognizing really that infectious disease really doesn't respect boundaries. You can have an outbreak in one country, and before you realize it, it's transcended beyond borders. So the importance of building global health security in every nation has really been critical, and I think has further been amplified to a really great extent because of the pandemic. That was those were very interesting times, and I'm hopeful that as we move forward, we will be in a position where we are able to leverage some of those key lessons we learned from the pandemic, and sort of help redirect that energy into other program areas, in public health and in medicine. I think the implications were really far-reaching, and it has really given us the opportunity to think critically. I would give, Dr. Mona, I'll give you an example of a field that been particularly very involved with, which is the field of really the use of genomic sequencing data that was very instrumental during the pandemic for tracking what variants were problematic in the sense of enhanced transmissibility or immune escape and those sorts of implications, and how next generation sequencing technologies has really amplified ways in which we can use sequencing data for not only SARS-CoV-2, but also the implications for things like mpox and enteric diseases, surveillance, salmonella and shigella and those kinds of diseases, and Vibrio cholera, which is still a problem in Africa where we are, CRH, which you see frequently, healthcare-acquired infections and things. So the implications for using genomic sequencing data was further amplified during the pandemic, and I'm really hopeful that some of those lessons are really redirected to other specialties as well, whether it's cardiology, whether it's oncology, whether it's gastroenteritis. And I'm really glad that you have been able to bring together experts in this different fields to the town hall to discuss about the future of those different fields moving forward. I know last time we had a talk from Dr. Abe Allen, who talked a little bit about the pharmaceutical sectors and how we can increase access to medications in Africa, which I think is really critical. As you know, Dr. Mono, we had issues with getting access to therapeutics in Africa, and we still do have difficulties with access to Paxlovid and Molnupiravir and monoclonal antibodies. Even the provision of vaccines were very, very much delayed. So I think we're at a critical junction in our history, and we have a lot of there's a lot of things that we need to do, and I'm hopeful that with initiatives like this, I'm hopeful that these sorts of initiatives can be rebirthed in other African countries as well, so that we can coalesce our efforts and our technical expertise in a way that could benefit the entire continent. So thanks a lot for everything that you did. I do remember your contributions towards advancing science during that very critical time. I know you were very, very involved in some of the critical clinical trials that took place in January 2020 with different immune modulators that eventually were enrolled in clinical trials to improve clinical outcomes in patients during those times. So thanks a lot for your leadership during that very critical and interesting time in our history. I just wanted to open it up and maybe hear some remarks from some of you who are in the town hall. I see Dr. Samuel and Ginny Cat is here as well. So Samuel, I really would like to invite you as well, and really want to hear about your thoughts about the last 100 sessions of the town hall, and what you think are critical redirections or critical directions that you think the town hall.
Yeah, Brian, before Samuel speaks, I wanted to share some very interesting thing I just saw. So if you look at these slides, these were the slides. I was just looking at all the episodes we had. This was the third town hall when we lost Manu Dibango. This was like our third episode of the town hall. And here you can see what our goals were really. We wanted to be able to help healthcare workers. This was the presentation that we did. We're anticipating at the time the number of cases that we had COVID, and we knew it was going to come to Cameroon. This was how Cameroon was reporting its cases. And so you could see that we were at the realm of the pandemic. We had things going on every week to discuss these particular things going on in Cameroon. So here you could see number of deaths. We reported this. We could see the cases rising. At a certain point, it was in June, when we had already understood a lot of things. And here we're proposing solutions already. The episode after that, we started talking about steroids. We even did in the town hall. This is very amazing how far we went in order for us to be able to see how we could share our knowledge back home. So I just wanted to share that some of those slides before going over to Dr. Samuel.
Thank you, Brian. Thank you, Mono. It is really a privilege to be part of the 100 session of the town hall. And when I look back, when I reflect, if you ask me, why do you come to the town hall? The very first thing with the town hall, all of us are professionals. We do continuing medical education. If you are interested in healthcare in Cameroon, this is more of a special. I don't think, just like Brian said, we have any other forum that can educate you by professional presenting professional information in healthcare about Cameroon and being expert in their own right. So that was enough for me when the first time I came to the town hall. Every fortnight, we have an expert. And of course, 2 weeks ago, we had Dr. Abel who presented on the pharmaceutical. The information that I learned from that, I'm just picking that as an example. We've had cancer. We get experts, they come and talk about that. We've had non-profit organizations doing wonderful work in Cameroon. And then we have updates from the government. Every time we have a town hall, we have regional delegate of public health, we have district medical officers, we have experts who are on the ground, and their contribution, they're extremely vital for us in diaspora. If you want to know what is happening back home, and maybe you've not been back to Cameroon, I'm still waiting. I know there are other professional organizations, but I don't think we have any other organization that can help bring the update. For example, the work we are doing in DUP, when I come to the town hall, I'm able to share exactly what is happening in the Northwest because we know what is happening there. We do have others from other regions in Cameroon. And this is really, really very important for us. If we really want to see a change in our health institution in Cameroon, healthcare in general, I think the town hall has provided that. And to crown it all was when the minister came to the town hall twice. It didn't end there. He became also very interested. Once he had the policy on universal healthcare, the town hall was the first place for the minister to come to announce the changes. And immediately after that, he got involved with the government right up to the presidency, and the working group was created. Yes, our system is slow, but I can tell you as the rapporteur of that group that there is a lot of background work going on, and it's come to the town hall. There are many other organizations that are mobilized because of what the town hall has done. And so the town hall now is like a role model of what we are looking for to make a change. Whenever we have a presentation, there is always some special policy that you can pick from that presentation. That which I know Elvis is documenting that, and the ministers, I bet you there are many officials who are listening to the town hall and they are taking note. And so, I mean, reflecting today for me, I just want again to thank all the team, starting with the chair, all the moderators. You have done this. It's really a selfless work that you have been doing, and I wanted to commend you and to thank you that we are all here to support, and I'm just calling on others that if you are interested in healthcare in Cameroon and you are in diaspora, this is the best place to come and learn. And I want to thank you, Brian, for giving me the opportunity. Thank you very much.
Yeah, thanks a lot, Dr. Samuel, and also thanks a lot for your work with the working group that was set up by the Ministry of Health. It's really a hope that this is going to be the start of many great things to come. You mentioned something around policies, or at least doing work that has policy implication. One of the things that we started doing a while, but which we have been trying to do for every session, was to always come up. I'm going to share my screen for a second, if that's okay, Dr. Mono. So every session, we started drafting this, what we call policy briefings. So policy briefing essentially summarizes the information that was discussed during a session of the town hall, and we pulled out what the critical components in those discussions were and what would be relevant in a one-page document that would be relevant for the Minister of Health directly. So most of our policymakers don't have the time. They don't have the time to maybe to read all the entire minutes of our briefings or debriefings where we discuss about different topics. But the ability for us to discuss and to highlight the key context behind the topic that was discussed, and provide that one-page PDF document directly to the office or to our policymakers or to the office of the ministry has wide, far-reaching implications. And we also started creating, at least generating, what I would consider to be briefing minutes, where we would discuss what was discussed, essentially what the agenda was, and we will try to talk a little bit about what the discussion points were, what the key points were, and try to summarize what those concise points were, what critical questions arose during the meetings, and then we can kind of put all of that, those meetings into all of those discussion or critical discussion points into a document which we can save within our own archive. So we've been trying to go historically and do this for every single session. And the goal really is, if we have a presentation on colorectal cancer, what is it about colorectal cancer which we might want to, in a very concise fashion, present to the Minister of Health that would help to increase his awareness of how critically important that particular subject is, and how and why it should be a policy priority for the Ministry of Health. So those were some of the things that we began to think about, because we had the question a lot about critical next steps after discussions with Town Hall. And Dr. Mona, I would like you to talk a little bit more. I know we've had long conversations around the importance of generating knowledge is one thing. Being involved in the fundamental research that generates evidence is one thing. Being able to translate those basic research findings into components that are translational, whether it's in clinically or in public health, is a whole different thing. The whole aspect of translational sciences and the implementation of those findings as well directly, either in clinical practice or in public health or whatever realm, it's really another field, right? And also being able to articulate our findings in a very concise way to policymakers so they can make sense of the findings that we've come up with, so they can enact the kinds of policies that would help provide better health outcomes. It's a whole different ballgame. But Dr. Mona, I really wanted to get your thoughts a little bit more about this aspect of implementation science and really translating findings that discoveries that we have in ways that can have direct policy implications.
Yeah, thank you, Dr. Brian. The good thing is that I see a lot of public health physicians who are here and those other subspecialties who are also subspecialists who are involved in public health. You know, doing research, promoting research doesn't mean you're going to change policy. And I want to applaud you for single-handedly taking this initiative so that every town hall we have is translated into a policy paper. And the goal is to always present that policy paper to the stakeholders back in Cameroon, and especially to the minister. Like I see Dr. Ivor Dieter is here. He did a presentation on colon cancer, and we had to write a policy paper on that. The policy paper is really telling the Cameroon government how feasible this is. What can we do back home in Cameroon to translate all this wealth of knowledge into something practical, affordable, which the government can do. And once you do that, it makes the job of the politician easier because they have a paper where they can use and be able to say, okay, we can decide and not use fecal occult. We can use this in order to do testing everywhere. Then those who are positive can actually get to do a colonoscopy. How do we get gastroenterologists trained in such a way we have the same number like Dr. Zume Maxer is here, send them to different regions and have a pivot point where we can do colonoscopy to high-risk patients. That's policy there. There is no way you cannot just paste something which is happening in the UK or in the US and you paste in Cameroon. You need to understand the environment where you are. So you need to translate that. And Professor Mukumbang Ferdinand, who is from Stellenbosch, I think he's now in University of Washington, Seattle. He's a specialist in translational medicine, and he came and gave us a talk here once. And that was a special kind of a talk. He's a Cameroonian. There are multiple Cameroonians that are talented, which we can use. So Brian, what I would say with this, I want to hear the opinions of others, but I can tell you that we do not lack the specialists to do this kind of work. I want to applaud you for what you're doing. No one pays you for your time for what we're doing. Our goal in the town hall is that every time we have a discussion, we should be able to translate that discussion into policy. And also, we have something called, which we're going to talk about as time goes on. I know now we're talking about translational medicine. Also, the Give Back Project. And those are all important facets of what we're doing here today. So, Brian, I think there are many others who may want to contribute into the policy discussion. I see a lot of people who are here. Dr. Zume Maxel is here. He's going to be our speaker, I think, in sometime coming forward. So that's we're happy, we're waiting and enthusiastic to listen to him. I think Dr. Ivor Dieter is here, and there is also Dr. Ombako Kingsley.
Yeah, thanks a lot, Mona, and also thanks a lot for those kind remarks. And I would really like to open it up to the audience. I really would like to hear from your perspective where you work, how has your work been able to have a direct policy implications in terms of changing how what the standard of practice is and what your recommendations really would be in terms of implementing this in Cameroon? Sometimes getting things done in Cameroon has a little bit been difficult, and sometimes we have to traverse some very difficult things. But I'm really curious about your experience, and I just wanted to open it up to I don't know. I want to open up to some of you here on the town hall. I see Dr. Marcel is here. I see Dr. Ivan Tita is here as well, and a few others. How has the work you've done really impacted? How have you been able to translate the work that you've done locally in such a way that stakeholders are able to, that has grasped the attention of stakeholders in a way that has led to transformational change? And what are some key lessons that you think we could leverage or we could learn from that experience that would help really in terms of getting things moving in Cameroon? We can generate all these policy documents, but we don't want this to be fed into chunks of papers that you just find in some ministry, I don't know, office, and it's just a bunch of papers. But we really want to see those translated into documents that really make things change, or that are consulted in order to have robust policy implications in the country. So I'd really like to open it up to you. I see Dr. Joshua Tambe is here as well. So just wanted to open it up. You can raise your hand or you can use the chat at any point in time if you have any contributions to make. Joshua, you can, or I see Dr. Marcel is here as well. So please feel free to take the floor and share your thoughts.
I think Ivo is muted. That's so.
Okay.
Dr. Dita.
So please feel free to use, you can use the chat or you can try to raise your hand and maybe share some of your thoughts. Even if you're a student and you feel that you've done work that, what are your thoughts when you think about this? Mona, I want to really share an example with you from some of the things that have happened in the field. There've been tremendous advances in the field of next generation sequencing, and I just want to give that as an example of a field that has undergone tremendous transformation in the last 2 decades. When I was doing sequencing in 2015, and this was when I was doing some malaria work, we're doing a lot of Sanger sequencing. In the early 2000s, with $1, you could sequence approximately 1,000 bases. But today, as I speak to you, with $1, we are now able to sequence approximately 100 million bases. So the cost of sequencing has dropped significantly. It has plummeted, which means that we are now in a position where we are able to really generate a lot of sequencing data. So we are generating a lot of data, a lot of evidence, but not a lot of translational or taking that data to make for something meaningful is still a big challenge. So there's still a gap in terms of how much knowledge and evidence we're able to generate, but translating those into impactful projects has really been a challenge in that sense. And we're in this critical junction where we are generating a lot of data, but not a lot of practical and actionable steps that's really emanating from the data. And that's where the global discourse is around. And that's why it's kind of sometimes slow when we have outbreaks of Mpox, like what we have right now in Central Africa, in the DRC, the Mpox outbreak. And it's lingering and is drawing. It took a long time before we had a genetic characterization of the Mpox virus in the DRC. And that's because of, it's just difficult to really piece those things together. So I think we're at a critical time where we have to reduce the speed in terms of reduce the speed between how we connect these different pieces together so we can have some more actionable steps. And that involves engaging multiple stakeholders across the board, whether it's engaging community health workers, whether it's engaging people from the field to policymakers to professors and all that. So I think all of those are really critical to the future of public health, and we have to figure out ways to engage all of these stakeholders. So I've seen Dr. Joshua. I don't know if you wanted to take the floor to make some remarks, Dr. Joshua.
So if Prof. Joshua is not yet there, I don't know if Dr. Ivor Dieter has any remarks. I know he's always very spot on to what we need to do to get things going back home and abroad too. So if he has any remarks, the others, even Dr. Ombako Kingsley, you guys can unmute the phone, unmute I see, yeah, Dr. Ombako Kingsley is here. And Kingsley, do you want to share or talk? You want to unmute yourself? We're having a discussion today.
Hi, everyone, and good evening.
Good evening.
It's my pleasure to be on the town hall this evening with everyone. And I would like to say thank you to all of you, to Brian, to Elvis, and I'm seeing Dr. Samuel is available. All those who contribute week in and week out so that the town hall should be a success. I think the impact of the town hall is really, really palpable. And then we have to sit back and really see in the long run. Sorry, I've been a bit unstable, but I listened to Brian. And again, the context is difficult. We have to decide if we are doing a top-down approach or it's going to be a bottom-up approach. It just depends on the particular health topic or particular intervention that we are carrying out. Much of the time, we realize that some things might not receive the blessing from the top administration. But once somebody starts doing it and it is found to work on the ground, then it's easier for them now to take over this initiative now and make it their own idea and now start working from there. Again, some projects suffer when we try to begin with a top-down approach. We explain most of the time to people who are politicians, people who do not have field experience, and so they wonder a lot or they bother what the intervention on the ground is actually going to lead to. But again, I think that we shouldn't stop from there. We should just go on what we're doing. We may not see very, very palpable results in the short term or maybe in the intermediate term. But believe me, some years to come, somebody will be able to look behind and say, I got this idea after somebody shared something in the town hall, and I decided to run with that vision or do something similar. We have a lot of brilliant studies we carry out, and we may want to write policy briefs and all of that. But I fear the context in which we work. Some of these policy briefs might just end up in on shelves in ministries, and people do not really take them and implement. I had the privilege of attending a meeting at the University of Boya with some representatives from the Ministry of Economy and Planning. And much of what they were trying to tell the university community is that you people carry out a lot of research, but try as much as possible so that the research that is being carried out in our university institutions should align with national policies, should align with national development plans. All right. So it's a difficult thing to do because if you ask me the 50-year vision for Cameroon, I can't tell you. There are a lot of things for which, if you ask me where our nation is heading to in the next 50 years, I can't say, but it should be such that every citizen should have a clear vision of our national vision for the next 50 years. That can help shape the way we do things at every level, the way we carry our research, and it's even going to help define our research priorities. But for now, individual specialists and research groups, they focus on what they like doing, focus on their different specialties. We focus on where the funding is to carry out research. But again, I don't think the administration is completely blind or completely deaf. I just think that they are bothered with so many other things. There's a lot of noise and they have to filter what they think is going to be beneficial for them. So we may be just one of those independent scientific committees that doesn't have any political ambition, that doesn't have any political interest, that is working just for the sake of science. So I think if we continue talking and doing what we are doing, somewhere, somehow, someday, somebody was going to pick up a discussion, pick up an idea from the town hall, and it's going to be implemented. But when it comes to real field work, again, yeah, there are a lot of difficulties on the ground, a lot of difficulties, a lot of challenges, because we have a very big problem, which is sustainability. Even small projects that are trying to do to improve upon care, we want to standardize reporting. I do a lot of oncology imaging now. You know, you want to get into the racist criteria so that you create a standard for every other person and for follow-up of patients. But then that can only work with the team that you have at hand at a given time T. People are mobile and they have other ambitions. So again, and it depends on how receptive the current working environment administration is. Within a short while, people move on, new team members come in, you have to keep on repeating the vision, and then equipment breaks down, you can no longer actually carry out, implement something practical. So you have the impression each time you start from zero, you start from, or let's say from zero. So it's difficult to build a team, grow with a team. They mature and then they are released now and they become leaders in their own right, go ahead and implement that. So again, it's a big problem. You can implement something, but in a short while, the initial people you started out with, they move out. Again, we can't stop people from moving out. But then when new team members come in, you need to begin all over again. It's a big challenge in our setting, but there's nothing as constant as change. So we just have to continue doing a lot of work. And again, as I said, the town hall has been very, very instrumental. It's helped us create a lot of meaningful partnerships. But the small steps on a daily basis, one day, I think just one small idea from the town hall can be implemented and it can change Cameroon. Thank you.
Yeah, thanks a lot, Dr. Joshua. You laid out some real challenges in the field and laid out some real issues, and thanks a lot for those remarks. You also pointed out the importance of visionary leadership for the country and really having a sense of direction where the country is headed for what the next 50 years, for instance, what that might look like. And I completely think it's completely agree. It's so important for us to have a sense of where we are going, so we can make strategic steps now that would help us to get to that point. And being in a and definitely living in a country or being in a government which doesn't necessarily have a clear sense of direction or a clear vision for the next 50 years makes it very difficult to take strategic steps in order to get there. So thanks a lot for sharing some of those challenges. You talked about sustainability and the importance of follow-up and reporting, how critical that is. You talked about some of the challenges with the practicality of implementing things on the ground, which are very real and very valid, things that we have challenges with. You talked a little bit about some aspect of movement and migration, which I think were critical as well. I don't know if Dr. Ombako is here. I think he put something in the chat, which I think is really important. I just want to maybe want to read
Brian,
it. Yes.
Brian, sorry, I'm very busy doing a few things, but if you give me the opportunity, I will beg Dr. Mbako to give me a chance so I can make my comments right now, if that's okay.
Yes, that's fine, Dr. Dieter.
Good. Thank you, sir. And thanks, everyone, for joining this session today. I was wondering whether the attendance was not going to be as impressive as we've seen recently, because we were just going to have a discussion of this nature, but it's nice to see that quite a good number of folks showed up today. To start with, I want to really thank the people that constitute the back town hall. I think you guys have done a wonderful job. Whoever conceived the idea, certainly kudos to them. And you guys have done an excellent job in trying to sustain the town hall in a way that has not been seen with many other groups that form from the diaspora. Of course, the group starts, there's often a lot of excitement, and then a few weeks, months down the road, it's all dead and buried. So you guys really have to be very proud of the work that you've done and where we are today. That being said, I think it is only appropriate that once a group like ours exists, it is very important that we take a time out, we take a step back and do what we call a situational analysis. We look back and see where we started, how we got here, where we are now, and anticipate or plan for where we want to go. And that comes with setting up an objective, a goal, and then asking ourselves, how do we leap from here to make sure we get to that next place? We have a huge, big mountain or river between mountains, this big river. So this is a very appropriate step in every initiative that looks to be sustainable or continue to make any impact in our societies. So the next comments I will make will focus on two aspects of every initiative. So we look at the form, and then we will look at the content. So in terms of form, it's simply how the town hall is run. Given where you guys started and where we are, what have you guys gathered? You can look at things like how are the numbers in the town hall going? Has our membership dropped? Has our membership stayed stable? Is it came together and saved this initiative still here? And if they are not, why are they not here? The structure, we run this every 2 weeks. Will people want this to be every week? Will people prefer this to be once a month? Based on that, you can gather data from attendance and the way things have been going. So And you look at the trends, not only attendance, but the trend as well. Are we seeing fewer people? What backgrounds are they? And you can answer a lot of these questions by designing a survey. And I will propose that a survey be designed and sent out to all the town hall participants to share their viewpoints, to give suggestions on how they think we can make things better. Even if we are doing good, how to get better. So it's very important to carry out that survey, send out a questionnaire, design it, easy to answer, short, not a long survey, and have our folks respond. And as such, you know you're doing something that represents what the people want. And if the people do not see themselves in anything that you're doing, you are likely to see that project fail. And even if you're succeeding, your numbers or the enthusiasm is going to go down. Now, so those are just a few aspects when it comes to the form of the town hall. We can then look at content. So what are we really doing here? What are we doing? What was our goal when we created the town hall? Was it just to have us come do these presentations and then we leave and go back home and that's it? I know when I joined the communication, I know we're talking about how we do policy papers, how we may be able to translate that in what we are saying here into really actionable things that can happen on the ground. I have always during this town halls pointed out that I think the nexus we have with the ministry is not strong enough. And those are the stakeholders you keep talking about. Those are the people that own the power. Those are the people that can make a difference. If we do not have a very strong nexus with them, how do we ever, apart from us refreshing our knowledge, learning about these new things? You talked about sequencing of bases. $1 today can do thousands, whereas a few years ago, we couldn't even do anything. Yes, I learned this knowledge, but I'm sure one of the main objectives of the town hall, apart from refreshing ourselves, was how do we make change on the ground? How do we change Cameroon? You're talking of the basis. I don't think any sequencing is taking place in Cameroon. How can that happen in Cameroon? We know about Martinez Ogo, who died to do a simple DNA test. It took forever. Dr. Muno will tell you that as an oncologist, he sees breast cancer, he's asking for simple markers, PR, estrogen, and HER2. And all. They are never done. But we all learned. He had a whole month where he talked during the breast cancer month. He did wonderful, brilliant presentations. Beyond that presentation, beyond this knowledge and the theory that we're talking about, how do we bring this to be realistic? Is how can we better form a more practical relationship with the folks back home, with the people that are responsible for making decisions that can really lead into any meaningful change. So that's one aspect. The next aspect will be, yes, the topics that we talk about. Sometimes are some of these topics just too abstract? Are they just too specific? So much so that when we announce a topic, we have a huge number of people that do not show up because the topic is just so abstract. So these are important questions, some of the important questions that we can look into. Should we, and that aspect can be answered on a survey. What will people want? What kind of things will people want? Even looking at it again in content, can we draw up a calendar well ahead of time rather than just announcing maybe 2 weeks to a presentation, who will be the next person? Maybe a week to it. People don't know. You know, we live in a very busy society where people plan, they have stuff, and if things do not, if they don't know about what is coming up and to see how important it is, nobody is going to create time for it. So I think I've monopolized the platform for quite a while now talking. But that's the kind of analysis and evaluation that this kind of a session, in my opinion, needs to be built on. We need to really look at it. Where are we? Where did we come from? Where do we want to go? Then answer the question, how do we get there? And in doing that, it's important to get a representative opinion from the population. Let every person's voice be heard. And that we can do by designing a questionnaire and doing a survey. The last aspect is we do all this here on a town hall, on a virtual platform. How do we translate it home? How can we link up with the people back home that have the power? We can talk all the stuff here, never gets there. Sometimes I don't even know if they're here. The policy papers you draw up, whom do you give them to? Can you, for example, let us know in here that some of the policy papers that have been drawn in the past have been transmitted to somebody and something has been done about it? Otherwise, we can just meet in the bar then and share a beer and sit quiet, which I don't think is the purpose of our group. So I will stop there for now.
Yeah. Thanks a lot, Dr. Ivor Dita, and thanks a lot for always providing some very critical insights and perspective. And I wanted to give the floor to Dr. Mono, and I see that Elvis too has joined, so I'd love to welcome would like them to respond. You've mentioned the importance of generating a survey, at least a situational analysis, and I think that's something that we certainly have been wanting to do. Sometimes having the manpower to do it, or at least having people who would take this, sometimes difficult because many of us juggle multiple commitments and multiple responsibilities, and sometimes to get that. But I think it's really a critical step to have a situational analysis of what the success and failures have been, and have some critical feedback from people who attend the town hall regularly, which I think that feedback can help to redirect the strategic future of the town hall. That said, I would like to pass it over to Dr. Mono and also to Elvis, who has just joined us. Dr. Mono.
Well, Elvis, I'll be very brief because I think Dr. Dita highlighted a lot of very important things for any given, be it an organization, being in a movement, to succeed. We need to, that's why we as a group, myself, you and Elvis, decided with Tkate and the other moderators that today we need to talk about a reflection. How did this all come about? Where are we going to? What would the future look like? And what are our goals? What can we achieve in the given administration and with the given human resources that we have? So I think, to me, it's a take-home message that at the end of this, we can promise we are going to do a survey in order to know what future discussions others would want, the content, and even the structure of the meeting. We would bring that up to the General Assembly to decide on how things will go forward. But what I can say, which is very important, is that the attendance has still been very constant in the town hall, which has been amazing to me. It's been, the topics may vary, but it's been averaging almost 50, even up to the last time, 50 to even times even 100 or 200, which is good for any online platform. And I think all the pertinent things Dr. Dita raised are things that we need to actually ponder and discuss about and see how we can move forward. We do need a lot of manpower behind the scene in order to help with some of those goals. And that is why we have always said the town hall is open to those who want to lend their knowledge, who want to help us too, in order to build what we are building for Cameroon. So moving on to changing policy in Cameroon. As a town hall member, I don't want to brag about a lot of things, but I think the town hall has done a lot. They could do more. But we have done a lot so far, but we can do more. But there are a lot of things we don't come and talk about, but we can do more. Creating the diaspora committee is a very difficult thing to influence the ministry and how things work, but at least we have that created. We have individual members who have done a lot of things at different levels, be it at the level of as an individual or as a level of policy at different levels, but we need to do more. So I would not say there is no room for improvement. There is a lot of room for improvement. There is a lot of room for learning. Every organization that stops learning, stops improving, is going to actually die out, even in technology. As one of my mentors always told me, the reason why the railway industry died in the US is because they thought their competitors were the airlines, and they did all strategies. Were looking at the airlines when the highways were created in the 1950s, and actually the trucks destroyed their business. They were more efficient. So in looking at that in that light, there's always room for improvement. You never know where competition is coming from. You never know where you can do. Our goal here is very simple. How do we improve healthcare in Cameroon? So I have taken, and I think all the moderators and everyone here, the town hall belongs to the people. We've taken Dr. Dieter's advice and his recommendations, and I think we're going to implement them.
Yeah, hi, Brian, thanks for giving me the opportunity, and thanks, Mono, for the excellent talk. And I apologize for joining late. I'm in Dallas, and I thought I was still in New Jersey, so I was coming thinking that the meeting starts at 1 o'clock, not knowing there's a time difference. Sorry. So, one thing I'm really happy is that I did not miss Dr. Tita's intervention. I wish, I mean, if I had missed this, I don't know where I would have really started, but I came in at the right time, because what he has said really is like everything I thought I would like to hear in this kind of a meeting. I really acknowledge all the points he has raised, and it's really important for us, really important to get this from a member of the town hall. You see, these ideas that, like Muno mentioned, we never even knew how big it was going to be and how far it was going to go. We were coming in at a very important point in time during COVID-19, which we thought at that point in time we're just solving one problem, COVID-19. Then it then translated to a bigger vision, and then we all stepped into it all like amateurs. No one was trained in moderating. No one was trained in managing this huge portfolio of Zoom meetings. No one was trained in downloading Zoom and putting it on YouTube. Every learning was just progressively as we found a need. Okay, great. So we kind of started by volunteering, and at some point in time when we had a first General Assembly meeting, there were thoughts about, should this be a bi-weekly meeting or should it be a monthly meeting? And we voted, and everybody said no, bi-weekly. And Mono and I were shocked by the outcome of that vote, because when we're coming, we knew everyone was going to say it should be monthly. When we came to that General Assembly and everybody who was in that town hall session said bi-weekly, we were like oh, bi-monthly, we're like, wow. So so we went back and continued every fortnight to have this conversation. But it's important to still get back to get the feedback after doing this for another year, to see if the feeling is the same, and to see if the enthusiasm is the same, to see if the feeling is the same. And that the best thing I've really heard is the fact that we need to do this survey. And there was a time we said, how do we make people to be attracted to volunteer to the mission of the town hall? And we've announced time and again, if you want to volunteer to be a moderator, please contact us. If you have an IT skill and you want to volunteer to help us on the back end with IT, please let us know. If you have any skill you think can be useful for the town hall, I bet you out of the 2,350 members we have, no one has reached out to us to offer any single service. It's either Muno working tirelessly to find who is the next presenter, Brian working hard to make sure that we get all the resume of who is a presenter and how do we, and then all making sure that we get the communication out. So moderators, if you noticed, we all started as a large team. Some people step back because of their different preoccupations. They have a lot of workload. They have family issues. It's all volunteerism. And no one in the town hall has ever raised a penny for any reason. Mono's vision was no one should ever monetize anything about the town hall. It should remain voluntary, and that's when we will see those who are committed. And for that reason, everybody you see in the town hall is someone who is doing this out of the passion. The moderators, I give you the hat because I've never seen this kind of commitment. For 3 years, Mono has never skipped a session. Today, we're praying that he should skip because he said he was not going to attend. He has a wedding. So we're going to write it in the history of the town hall that he skipped at least one out of 100 town hall, but he surprised us by being here, which is incredible. I've skipped some sessions, right? Brian has skipped some session, but he had never skipped a single session. So I'm just thinking that this is really amazing, but I think there's a lot we can do. We can bring in more people onto this panel. We can bring in more people onto the leadership team of the town hall. We can bring in more people onto the moderation team, and we can really redefine the way this business is being done. And we can bring in new ways of doing things. And we can strengthen the relationship with the government. We've brought the Minister of Health twice as a guest on the town hall. Not an easy thing to do, to bring a government official to come to a platform where no one has given maybe pre-written questions for people to ask him. Everybody come with a free mind and ask him questions. We're afraid that he will not accept. He accepted. He's done that twice, and he still wants to do it a third time. He said he was going to create a committee for the diaspora in the Ministry of Public Health. He created it. He said he was going to appoint at least 3 members from the diaspora, from the town hall, to be members of that committee. He did it. Dr. Samuel is here. But just how effective that committee is what we have to question. Are they doing what they were said to do? Are they influencing things enough? How do we make sure that every session of the town hall is translated into a policy document and channeled through them to give to the right channel in the Ministry of Health? How do we make sure that our feedback is being taken into consideration? Those are the things we need to think about and get to do going forward, which I think Brian, who is I don't know how he learns all this thing. He has come up with technologies on even how he can get summaries of this Zoom call, translate them into policy document, and just how to refine it and forward to the right channel is what we need to do going forward. I can tell you, Brian has already customized this Zoom meeting. At the end of it, every end of Zoom meeting, Brian is able to just click some few buttons and get feedback, and then go back and analyze it and make sure it reflects all what we discussed and translate it into a policy document. So Brian has put that in place. The question now is, how do we take that and where do we send it to? Which are all the things that we would be able to find a way of doing it. And I think going forward, that feedback from the entire town hall is very important to us, Dr. Dita. That's the next to do thing, which we have to make sure that we get it as soon as possible. So I just want to say how excited I am to be part of this 100th session of the Cameroon Town Hall. To me, it has been an incredible experience, right? Like just the network, the people, and the culture. The town hall, there's one thing that is interesting in the town hall is how do you bring people together and form a culture where everyone can identify? You know, in every business you have the environment, you have the work itself, then you have the culture, and then you have the informal organization. When we talk about the parking lot, a lot of connection happen in the parking lot, which is the informal organization of the formal structure of the town hall. But there, people have created amazing connections. I can count the number of students who have traveled out of Cameroon to go for maybe further studies or for scholarship or for internship based on the network they have created during the parking lot. I can count the professional growth experience people have had based on their interaction in the town hall. I can count those who have had their project, you know, facilitated and easily made possible in Cameroon because they are a member of the town hall. I think when I was at Columbia University, I did a course on contemporary diplomacy, and one of the things I learned was the power of soft and silent diplomacy. A lot happens that can't even be put out there when it comes to silent and a soft diplomacy. And I think that's what the town hall is. We might not be a formal structure. We might not really have some instrument to directly just point out that this is what our session have impacted, but there is some silent diplomacy and you know, soft diplomacy going on, which the town hall is using, which is very powerful. I just want to assure you about that there is a lot of silent and soft diplomacy that the town hall is doing, which is very powerful and is impactful. Even if no one gets to track it on the data to publish it on the paper, that's not the most important thing, but the important thing is that it is creating some impact somewhere. It is changing something somewhere, and it is impacting some life somewhere. If nobody ever gives the credit, that's not what matters. I think we should find a way to continue to create more impact, as Dr. Dita Ivor said, in a way that we will impact more people based on the power that we have. So thanks so much, Brian. I must have spoken a lot.
Yeah, Elvis, I just wanted to add something. I think going forward, we're working on getting CME credits for participation in the town hall also. As you all said, there is a lot of information sharing. I saw Dr. Joshua Tambe did put that I think the vision of the town hall is information sharing for better healthcare in Cameroon, which I think we've achieved that very well. And I just want to highlight some few organizations that have worked with the town hall in ways that are unbelievable. We do have the delegate of the Southwest region, the delegate of the Northwest region. There are multiple projects, Elvis, that we can talk about that we did with those two delegates. The regional hospital Northwest has been a wonderful partner in terms of both facilitating and also helping initiatives with Bingo Hospital in order to help treat our patients and our mothers and fathers back home. So there are multiple initiatives that are going on, which I really just want to thank those directors for facilitating those things and showing us that we can use both top-bottom approach by approaching the minister himself, and also use bottom-top approach by making changes locally where we can actually influence healthcare for specific patients back home. So I just wanted to highlight and use this opportunity to thank those particular people back home who have facilitated things for us.
Yeah, thanks. Before I pass it on to Franklin, Maloba, and David, and the other people whose hands are up, I don't know, Dr. Ndita, if you had some thoughts after hearing some of the feedback from both Dr. Mono and Elvis. Dr. Dita. Okay, I think we may have lost him for a minute, but love to hear. And I think one of the things that Dr. Monam and Elvis have mentioned is how open we are. So if there's someone here who thinks they can design a quadtrack survey or a sample survey on RedCap or something of that kind, and probably restart, that would be helpful. That's certainly going to make a huge lift for us, and we can always work on the back end on how we can deploy that through the town hall to as many people as possible. So that I think would be something that is feasible, and then we promise that we will work on that. And if there are volunteers or people here who think they can help in that as well, I think that would be very helpful. While waiting on Dr. Ndita, I would like to call on the Maloba. Maloba, please, over to you.
Yeah, thank you everyone again, and hi to everyone. Yeah, it's always a pleasure to be at the town hall. Yeah, since I learned about the town hall, I think this is my second year. I've always endeavored to be there because I have learned a lot. Yeah, and I wish to thank those who brought up this initiative. I think it has been an excellent initiative where it tried to connect the diaspora and also those back home. I worked in Cameroon for some years, but the truth is I did not really know what was really happening till the town hall have to expose me to many of the different areas that have been covered by specialists. Yeah, and through the town hall, we have realized that there are still many gaps that need improvement in Cameroon. And I believe, as Dr. Service has mentioned, I think that the minister is always here to take some of these things into consideration. Yeah. Despite the good things that the town hall is doing, I think that there's always call for improvement. Yeah, most often with the town hall, what I've realized is that it's mostly those in the US and in Cameroon that are presenting. I've not seen a good coverage from those in Asia, other Cameroonian Zewa researchers, if they are aware of this. And then most recently too, from the time being, I have not seen those from Europe participating a lot. And I believe those guys are doing a lot of excellent research in those areas. I know when it concerns Asia now, like China, especially with the advent of artificial intelligence, I see most of the Chinese do a lot in that aspect and how they are linking artificial intelligence to pathology and things like that. So I do not know if we can try to engage Asia, Europe, and other part of Africa from Cameroonians so that we can get a broad mastery. But I know it's a step forward. We are already moving a step, and with time, all of these people can be engaged. The other thing I wish to recommend is that at times, people like Dr. Mono was presenting about breast cancer, and which we realize that is a major problem in Cameroon. I wish to find out if the Town Hall can contact some of the clinics that are engaged in that, where they can make sure that some of their nurses, some of their lab specialists, technicians, should also be there to connect, to learn what is happening, I'm sorry, with my daughter here, she loves science. My little daughter, she's 7 months. She always likes to talk behind me, especially this weekend. So I'm sorry for the background noise a bit. Yeah. So I think that we can reach out to this hospital who are performing these activities so that they can have a good attendance, because through this, knowledge is never wasted. Through that, it can challenge some of them to try to see if they can further their study in these areas. So I think that we can reach out, because I've seen that you guys know most of the medical doctors here, and I'm even surprised how you guys are already having link with these medical doctors back home. How can we engage them more with those in their facilities to learn from the Town Hall? Another thing that I wish to recommend is the Town Hall have come up with a lot of policy, and we know that implementation is something that is always still lacking. I don't know what the Town Hall can propose in terms of implementation of many of these policies. If there's a way forward, I think that will go a long way to make our time here very useful and more impactful to those back home. The other thing that I want to look into is capacity building. I know Evis talked about that in the mention about that. Yeah, when most of the presentation I've noticed is that there are a lot of gaps in Cameroon. But in Cameroon, we see a lot of youth graduating from schools and they don't even have job until doctors have to go and march to the ministry that they don't have job. And these are talents, and these are people that can cover most of this gap that we have identified, like in terms of pathological lab, in terms of even pathologists in Cameroon, even in terms of diagnostic, in terms of pathological diagnostics. How can we engage these people, these wasted resources back home, to be more engaged, and how can we ensure proper capacity building, which can give them something to do, or hands-on experience that can give them job to cover some of this gap? I don't know if the Town Hall has a vision about such gaps to enable them to cover. Another area that I've noticed also in Cameroon is we have a lot of students, our friends that are doing PhD, they do not have money to even run that PhD. I, for one, when I was in Cameroon, I started a PhD program, and my research, it was in malaria, which needed about almost 15 million to run that project, but I could not do it, sincerely. And up to now, I've not been able to defend that PhD because of lack of that funding, which I'm trying to do now personally. So how can the Town Hall, I know they have already done a lot where they have linked students to many of the people, some of the people here, especially doing their after presentation hours. How can we, because we have a lot of specialists that are here, very brilliant, and I know most of them already have grants that they have won, and that they are using this money. How can they try to engage with some of these students and be helpful to some of these students back home so that they can get some of these degree, and where also they have learned hand-on experience from these specialists and where renowned people abroad, so that they can implement that home to really make things better? Yeah, I know it's too much that I'm really asking, but I know with the Town Hall and with the people I've seen here, we can do it. Yeah, I know it will take a time, but I think just starting with a step, we can always move forward. Yeah, with that, I wish to say thank you, the Town Hall. Thank you for all those who have brought this initiative. I hope that we do better and we go better to improve and make Cameroon a better place. Thank you.
Yeah, thanks, Maloba, and also thanks a lot for your dedication and commitments. I think you're one of those that has been consistent from the very beginning. And thanks a lot for always providing very, very helpful and critical feedback during and after every session. So it's really been great. And you raised a lot of really important points, which I think are really important discussion points for the strategic future of the town hall, and I take those to heart, and I'm sure that Dr. Mono and Elvis and the others here as well have do recognize the critical importance of those different things. You talked about funding and how do we find funding really for basic science researchers in Cameroon to run projects in Cameroon. You talked about the importance of engaging Asian Cameroonians. And you were talking, I think, in the direction of AI, and I know this is a very interesting time for AI today, and really leveraging the direction in which that field is headed to enhance some of the things that we are doing locally in Cameroon. So I totally agree with you on how critically important that is for the strategic future of our country. And I think you also mentioned about the importance of capacity building, which Dr. Monotu has been very engaged with, and really how to engage, how to train even our own medical students in Cameroon, how to ensure that people have the capacity to learn. So even exchange programs where students from Cameroon come to the US and are paired with clinicians here to gain some skills. I think those are also critically important. I just wanted to give the floor to Dr. Mono or to Elvis if you have other thoughts on some of the feedback that Dr. Maloba shared on these different subject areas. Dr. Mono.
Yeah, I want to give time to others to give us their contribution. I think we've taken Maloba's recommendations, and I think they are pertinent. There is just one thing I want to highlight, that we have always, and those others in the town hall, those who are talented and they see that they do have areas of weakness in their different fields, should not hesitate creating courses in order to share back home. Because my experience during the breast cancer week lectures that I get online, the average participants were almost 100 and something. So that was very encouraging to me, that 100 and something nurses, doctors could come online for 3 days and listen on how to properly diagnose and treat breast cancer. Multiple oncologists asked for my slides, which I send them to them, showing you their interest. Multiple residents who are in oncology wanted my slides, and the GYN residency program in Yaoundé wanted to organize me to talk to them. I don't know what happened with that, but that shows you interest. So I think it's one of the things I would always say, if you're providing knowledge to people at a certain level where you think that you can help, I think they would listen. So thank you, Maloba, and we are going to continue doing what we are doing, and we'll strive to improve. That's all I have to say. I'm interested. I really want to listen to the feedback from everyone who has something to say.
Absolutely.
Yeah.
Thanks a lot, Dr. Elvis, you want to say something? Please go ahead.
Yeah, just to thank Maloba for he's one of our fervent participants. He's always come on board and participated really actively. We really want to appreciate you, Maloba, for your interest in the town hall. The comments about having other representation from other parts of the country, of the world. We've had presentations from interventional cardiologists from Germany. We've had presentations from people in UK. We've had presentation from someone who was, I think, at that time in Japan before relocating to Canada. So, but I think one thing I got from Dr. Dieter Ivor's point is, how do we, going forward, come together to form a panel that can look through some very interesting topics for the next 6 months and outline them well in advance, and make sure that we find a representation across the geographies you've mentioned, maybe progressively for the next 6 months, and communicate it so people know exactly each month what they expect. And if in case we decide after our survey that we are going monthly, it's easy to be able to do a forecast of the next 6 months, what we want to talk about. But I think listening to Dr. Dieter and also to you, Maloba, I also think that one of the things Town Hall can do is how do we generate our topic to reflect what is coming from Cameroon itself? Like they always, if you use the community approach, that you get to the people to tell you their problems, not you thinking we are all Cameroonians. Yes, we are all in the diaspora. We have some people in Cameroon. We know Cameroon. We've practiced there. Yes, but how do we frame our topic in a way that even comes from some of those who need us back in Cameroon, like Ministry of Health, district, our doctors in the district? How do we frame our topic in a way that reflect what they want us to tell them, or what they want us to have a conversation around? Not us maybe as moderators thinking about the fact that, hey, I think we should talk about cancer next week. Oh, I think we should talk about HIV the other week. But how can that be in such a way that it comes from the base, from what they also want us to talk about? So we will find a way to make sure that we kind of have a strategy to have those topics align with the needs, but also the geography, the areas of expertise that we need, and the impact that we want to see after that. So that's just what I wanted to add to your comment, Maloba, but also just to say, you know, we can only do what we can do. Muno mentioned about doing a course where 100 and something people attended. That's super, right? But impact, if you can impact one person, think about the ripple effect, right? It must not be 100 people. It could just be 50 people. It could just even be 10 people who attend your session. If you can impact those 10 people, it is great. So thanks so much, Maloba, for being.
Yeah, please. Sorry, there was one point I missed, and this goes directly to Dr. Samuel. I don't know, concerning policy, Dr. Samuel, in the policy, is there any forum where the ministry is trying to encourage some of these specialists abroad to come back home by increasing salary or giving special stuff? Because it doesn't make sense that all we do will come specialists are here, and some are here are struggling without even papers, but they don't want to go home because of the situation. Is there any way forward that the ministry is doing with this direct connection that the town hall has with the minister to encourage these guys to come back home? Thank you.
Thank you very much, Maloba. I want to thank Elvis. There is a lot in the background, and I know that Mono or Elvis didn't say that there is a strong connection with the minister in particular. And I wanted to add that even though we haven't had the main working group talking about what is going on, the technical team of the working group is working, and the minister is setting up a website that will help all of us in diaspora. All the information, all the policy that Brian is putting together, all the suggestions that we have will go directly to the minister. Right now, that's why I want to thank Elvis. The minister is listening, and you know everything that you do, it is not only within the Ministry of Public Health that all these decisions are made. We know Cameroon, and I want to say that yes, all what we are proposing, the minister is taking into consideration. And the technical group is working on, once everything will be done, that presentation will come back to the working group. And once the decision will be made, the town hall will know exactly what all those proposals of policies that we have already recommended, which one will be implemented. But the very first thing that we're working on is like take for example, Maloba, you are trying to send, I don't know, some spacemen or agents to a student in Cameroon. What we're working on, maybe in the next 3-4 months, when that goes through, you can channel it through the working group and the town hall, and that will get to that student. And if there is a particular policy that we have as a proposal, it's going to go to the minister directly, and the working group will deliberate on that policy, because the working group is a body that will make recommendations on policy changes to the minister and his team. So for now, I will say that I am actually surprised that they have made a progress because they are at the level of budgeting. And when it comes to budget, it is not just the Ministry of Public Health. Once all of that will be sorted out, 2 weeks ago, there was a meeting about actually having that budget approved. Things are slow, but I would say that the town hall has done a lot to really get the government, especially the Minister of Public Health, aware of what we are doing. And I mean, I know that it's not something to say, right? If the Minister of Public Health, through the town hall and through the connection with Elvis, at the time where they are no more authorizing health institution, because they trust in the town hall, one of us in the town hall has their imaging center authorized because the minister trusts the town hall. I'm saying it because I have gone through that process. Those of you that have health institution in Cameroon, private health institution, if you know how difficult it is to get that to go through, but thanks to the town hall and thanks to Elvis and thanks to the team, the minister trusted what we are doing and went ahead and authorized the creation of that institution. So things are being done. There is a lot that we cannot mention here, but I just wanted to bring that in since Franklin brought that up. Thank you.
Yeah, thanks a lot, Dr. Samuel, and thanks a lot for that feedback. I also see that, and again, on the subject of capacity building, I think really solving the root of addressing the Cameroon medical students is also very important to the strategic future of our country as well. If we can have sessions where, and I do see that the past president or secretary of the Cameroon Medical Student Association is here as well, and I think that's grand. One of the goals really has been to see how we can really to work with medical students who are still in medical school in Cameroon and engage them in some of these discussions and have them be involved in, and if they have difficulties and challenges, whether it's in research or in particular aspects of clinical medicine, like the interpretations of EKGs, for instance, sessions that are dedicated towards medical students to enhance their capacity in those areas has been one of the critical gaps that I think that the town hall has really stepped onto. So thanks a lot, Maloba, and you always really provide very insightful comments. So thanks a lot for that. I want to call on Gilbert, Mickey. Gilbert, over to you.
Hi, Brian. Thank you very much for the opportunity, and thanks to Dr. Mono as well. I just want to say thank you. It's usually not easy to start off something and stay consistent. We are now talking about the number 100 session. Looking back, it's a long journey that we'll be able to cover. And I want to thank Dr. Jesse as well, who just maybe made me to understand that something like this is existing, which is really good. I won't say I've really been very, very stable following up what the town hall is up to, but any opportunity I've had, I think this is something I don't miss if I do have that opportunity. I just finished up with my PhD program at the University of Reading, where I focused my research mainly on school health and nutrition programs. And I'm currently based with the London School of Hygiene and Tropical Medicine, researching with them. But one thing I want to highlight is the relevance of the town hall and how the diaspora can be able to connect what is happening in the different areas of their operations abroad and how that can benefit the people back home. And I think the town hall, listening to Dr. Samuel, is really exciting to see that the ministry, I think the Ministry of Public Health is one of the very responsive ministries in Cameroon, I must say so, without any fear of contradiction. And I think it's an opportunity for the diaspora to leverage on that openness, leverage on that that readiness to collaborate, to make a difference in our communities. And I just had a couple of things I noted down here, beginning first with research and teaching. I think the town hall, first and foremost, can really serve as a point of contact for teach and learn opportunities, be it for those who are already practicing in the field and those who are still in med schools, to understand how things are happening globally in the public health domain. I think that alone is very important. Teach and learn opportunities, not just rampant presentation of case studies, but we'll take up areas, maybe very fundamental areas in nutritional epidemiology, for instance, and we are able to bring an expert to speak on key thematic areas that are emerging in this area just to connect that knowledge with the people back home. I think it's very important. And coming in the area of research, I think at the level of the London School of Hygiene, I am mainly in the population health department. And there is something we are very critical about. And the research consortium, which is where I work, is been established based on the lessons learned from COVID-19. How best to respond to emergencies in the area of school health and nutrition, or epidemiology, nutrition epidemiology, and so on. But I think that COVID-19 has come to teach us a lot, and how best to set up our systems that can respond in a very timely and effective manner to the things that are going to be affecting the health and well-being of our people. And we could see when we talk about lockdown issues during COVID-19, I wonder how many nations in Africa could effectively lock down and be able to do what they are supposed to do, like their Western counterparts. So what lessons did we learn from there, and how can we prepare for future emergencies? Because whether we like it or not, those emergencies will come in different shapes and forms. How ready are we to respond? And I think that the town hall is a critical stakeholder to begin to profess some of those solutions, provide some of those policy briefs, policy directions on how the ministry can be engaging. Still on research, I think Dr. Foma and Brian, I think this is something we need to be very critical and intentional about. How do we help our universities back home, not just to conduct research for research sake, but to conduct research that is going to be responding to the needs of the people in the communities? This comes to funding. Good research takes a lot of financial engagement. How do we help these young people to be able to conduct research that is robust and rigorous enough, answering some of the critical questions that can help us drive the public health system forward? I think this is very important. We don't just want any kind of research. We want research that can be translated to evidence-based, practical, having evidence-based practical implications in what we are doing. Then I just wanted to come, Brian and Dr. Mono, to say the town hall needs a theory of change. The town hall, seriously, I think we've gone to a certain level where we need to really understand how best, what kind of approaches we can put in place to engage the different people in the different sectors. Because I think we are working in a sector that is quite multidimensional. It's not just, before you look at health, it's not just about looking at it from the face value. You're looking at the anthropological perspective, you're looking at the culture, and so on. How do we engage the different aspects that the impact of the town hall can actually be felt? And so I had a couple of suggestions to say, if we are thinking about a theory of change, how this we want to influence the health sector back home, we need to think about our engagement approach. Who are we engaging? How are we engaging them? Brian has already mentioned about the policy brief. That's one aspect. How do we distill that information that we're generating here to filter into the systems that we want to influence the change we want to see in the Cameroonian context? Then we need to be very clear about the impact pathways that we want, which different areas that we want to really see our impact felt. And maybe thinking about the cross-cutting issue, I think from the beginning, you mentioned the need. Maybe we should be very clear to say someone in Furowa, the kind of quality of healthcare the person is receiving there, it should be something similar to what somebody in Douala or in Yaoundé should be receiving. How do we achieve that? So those cross-cutting issues needs to really be taken into consideration. And I'm happy the ministry, Dr. Samuel is here and probably is there to connect us with the ministry and to let us know how best we can be a part of that dream to see that somebody in Furowa, in Batibo can have good access to good quality healthcare like their counterparts in the cities. I will just be coming to the end of my talk to say, Dr. Mono and Brian, we also need to not just to randomly have the town hall sessions. We should not be very responsive. Let's go to Dr. Samuel and the rest of the stakeholders on the ground. Ask them, what are those areas that they really need help in terms of capacity building, in terms of infrastructure, in terms of technology or whatever? What are those capability areas that they actually need the town hall to come in to support? I think in that way, we will be tailoring the town hall activities to meeting the needs of the people on the ground. And this is where I will also highlight that Dr. Samuel is been an uphill task working back with the institution back home to say we at the level of nutrition we succeeded to secure a little bit of support. And I'm really happy some of the members, I got them at the town hall here, that we worked very, very hard to secure the support from World Cancer Research Fund. And we're working together in collaboration with ICONIC. ICONIC is international collaboration in nutrition in relation to cancer. And so they are setting up centers of excellence in Africa to facilitate nutritional assessment, talking about age for weight for height, and so on, just to help communities to be very nutritionally aware on how best to prevent cancers and so on and so forth. So 5 centers have been created in Africa, approved for Africa, and we fought very hard to have one hosted in Cameroon. And we're working to see how the Ministry of Public Health is going to help us to navigate to see that the rest of the work is actually sorted out for us to establish a center in Cameroon. 3 of our students back home, because this is part of the capacity building. 3 of our students back in Cameroon will be trained in the UK on how to manage that center. And we're very keen to establish a close collaboration between the town hall and the Ministry of Public Health back home to see that this vision is realized. With that much, Brian, I will leave it here, and I want to stay connected to Dr. Samuel to see how we can carry this forward. Thank you.
Thanks a lot, Gilbert, and it thanks a lot also for your work, and you mentioned some very important points, and I'm glad that this has been there are so many salient points that are being raised in this discussion, which I think is really critical for the strategic future of the town hall. So I think all the comments you've made have been they have been duly noted, and I'm also thrilled to hear that you work in the area of nutritional epidemiology, and it'll be great for us. I also think it's a critical gap in Cameroon as well. And congratulations on establishing multiple centers in Africa. And I hope that we are able to help you accomplish the establishment of a center of excellence for nutritional epidemiology, nutritional research in Cameroon as well. So definitely would love to see how we can collaborate to work on that. So thanks a lot for your feedback. I really really appreciate it. I see Khan Quicks, forgive me if I mispronounce the name, but please Khan.
Brian, maybe before Khan speak, let me speak as one of the moderators, and sorry that I'm late. I just want to speak to what Gilbert said. I'm aware of Gilbert's work, and Gilbert is doing some really, really phenomenal work. And I think I'd spoken to Dr. Mono, and we probably would not been able to bring you on to show us what you're doing across Africa, not only in Cameroon, in the Northwest, especially with everything happening with the socio-political unrest, in Malawi as well, and other African countries. Really phenomenal work. And Gilbert, I just wanted to highlight that and really say congratulations. And it's great to know that you're now completed your PhD, which is a wonderful thing. And the discussions are great so far. I'll just end there first. I just really wanted to throw that out there and probably come back later at some point. Thank you very much.
Thanks a lot, Kathy, and thanks a lot for joining as well, and also thanks a lot for your commitment to the town hall as a moderator as well, and all the feedback that you offer. Just to note, I don't know if Dr. Mono, you have any comments regarding what Dr. Gilbert shared, because I think he raised some really critical points, and I think that we should leverage some of these success stories from what has worked in other African countries and see how we can redirect some of those to Cameroon to help. Because across the board, we might have similar challenges in terms of political infrastructures and engaging stakeholders and all that. And I think some of those can be redirected in some capacity to help with some of the issues that we have in Cameroon. I don't know, Dr. Mono, if you have some thoughts. I know Dr. Gilbert shared a lot, but I thought he shared some very deeply insightful ways that we can think about these issues.
Yeah, so I think I've had a long conversation with Kathy about bringing Gilbert on to do us a presentation. I think, Gilbert, maybe, I don't know if you knew about it, we'll be reflecting about you, getting you here so that you can share more light about what you're doing in Africa, in Cameroon, back in the UK. So it's each time we identify a young Cameroonian, I'm fond of wanting to promote younger. I believe that the young actually are the future of tomorrow. I've always thought about it that way. I'm not a generational monster that wants to bring my professors here, but I really want to bring any young mind. And we are open, as you know, we're open to solutions. We're an open book. We are willing to sail the ship to anywhere in which is going to guarantee us success. And we need sustainability in the organization. The town hall belongs to us all. Elvis didn't tell you, when we registered the town hall, we registered it as an association that belongs to the people. Deliberately. We didn't register it as it's an association that belongs to the Cameroonian people. Though it was registered in New York and New Jersey, it's registered as an association that belongs to the Cameroonian people because we did it deliberately. We want every healthcare professional to see that they can strive and bring change. We're starting with education. We're moving from education to policy, and we are moving slowly. And if you come in with a lot of zeal and enthusiasm in a particular field, we're going to help sail that ship in a sustainable way towards that. So I just want to reassure everyone here that we are listening to them, and we will do our best in order to make the changes that will keep this organization going by keeping the pillars of what we're doing and extending, but not extending beyond what we can do, but still staying within our realm of how we can be actionable. So Brian, I took all of Dr. Gilbert's recommendations, and congratulations for your PhD. I know you're going to make a lot of a difference in Africa. Not only Cameroon, a lot of a difference in Africa. Nutrition is key. Most children get their brains not developed from the time they are young, so their capacity is never up to where they should have been, most of our kids. So nutrition is key for everyone. So we're looking forward to having you at the town hall sometime in the future soon. sooner than you think. We've been squatting you around and looking around how to get you in here. Brian, over to you.
Yeah, thanks a lot. And after Ken, I would really like to call on Dr. Polo as well, who was here last week as well. And she shared some really critical comments in the chat as well, and really would like to invite her thoughts as well. Ken, are you able to unmute? And Ken, over to you.
Thank you so much, Brian. I am Can Click Smiler, and a very good evening to everyone in the town hall. I've been following the town hall for over a year and a half, but mostly from the background. I'm so overwhelmed with the achievements and what is actually going on. And personally, I've also benefited a lot from this town hall. I may have so much to say, but just permit me go in any order, as well as I may repeat some issues. I think this meeting is very, very important. And I would like to suggest first, if it has not been done, that we may keep the next presentations or discussions on hold until we really come out with something concrete from these particular discussions. We may gather the ideas today, and in the next meeting, we may pick 1, 2, 3, 4, 5, 6, then we'll discuss further about them until we actually come out with a real pathway that we have to follow next. Otherwise, we may need to start back all over again when we meet the next time. So I'm actually suggesting that we should actually map out this particular call of today so that we actually come out with a roadmap. Somebody talked about a theory of change before we can really continue, even if it means that those things can be going underground while we get back to the normal routines. It will be very excellent. In addition to every other thing that every other person has said, which is so wonderful, I would like to think a little bit aside, if that has not really been in program, that we may move from the virtual
Yeah, it looks like we may have missed.
Yes,
okay.
I'm back. Sorry about that.
Okay.
Yes, thank you. So I'm saying I would like us to move from the physical or from the virtual to the physical. And by this, I'm suggesting that we should have effective presence in Cameroon. We can have an association that will be physical in Cameroon. Now, we've talked about knowledge. We have people, resource persons. We can leverage funds, but nothing is actually taking place. And we have people who can mobilize resources for us. I think if this organization or association becomes physical in Cameroon and works like an implementing partner, I mean, we are going to have persons who are going to sit there constantly, and they are going to address this. It could be research, it could be policy, it could be health interventions. And once we get those type of things, we can go into implementation. Let's take, for example, if we have a domain under policy advocacy, and we give these recommendations to the government, of course, the people in this bureau in charge of policy, they begin to monitor. If we have a research that we have to do, perhaps people can come from outside and pass through the association to implement research. I'm saying this because we've already established a very good name, a very good presence. And I think if we go into implementation and follow up, we are going to be just so superb about it. And if we go to another extent, we might end up having grants to run other projects, which we are going to model it in a very dynamic way that suits majority of us, because we are dealing with experts here. We have people who have even retired and who still come back to give us advice, give us encouragement, give us guidelines. And I think if we can leverage these people and actually implement projects in Cameroon, the vision is going to be very far. At the same time, the virtual presence is also going to be ongoing. I'm looking at it from this direction. Ken has attended 100 sessions with us, which is very magnificent. But imagine how much of that will happen as time goes on. Of course, his priorities may change, even for Ndasi, Brian, your priorities may change, other things might come into play. And we are not
Yeah, my sense again is I think we've missed him, unless it's okay. Yeah, Dr. Mona, I think Ken is sharing some very deep feedback, and I think those are very, very strong remarks, which I think
So
really work.
I do like, I think we have a sense of what Khan's feedbacks are, and we're going to take them into consideration. But I'm a believer of, there's only one thing which I would always say, I'm a believer of continuation while improving. You don't stop progress while improving. So things have worked. Though, despite the fact that we are getting a feedback of what is going on, I'll tell you, a friend of mine who I've known for so many years asked me a question. There's one thing they know about me is that we don't give up. They know I don't give up. If I do anything, I either do it well or I don't do it. He said, the town hall, I met him today. He said, the town hall, you are leaving this wedding and going for the town hall. Are you kidding me? I said, yes. He said, the town, that's a reflection of this, my brother's wedding. That's a reflection of how much passion we have for this. And it's just devotion for this and making sure that it goes on. The first goal is really a virtual. We don't want to, I don't want to miss the goal of the town hall from other people's ambition and goals, which we're going to strive into. The first goal of the town hall is creating a platform where we can discuss issues, look for solutions. Discussion for me and raising issues has always been a very important part of any change. And that to me is a centerpiece of what is going on. Every organization is looking for, nobody is going to go back to complete physical meetings. We need hybrids. Online is going nowhere. If anyone thinks it's going somewhere, I will tell you these big organizations that I belong to, ASCO creates the biggest meetings in the world. In the world, the American Association of Oncologists, we have the biggest meetings in the world, apart from any other organization. There is no that rivals what we're doing. It's gonna be hybrid, and I see what Khan is saying, and I'm just getting that because there are others who have contributions to do. I think I've taken all his input together, but we need volunteership. We need people back home who want to do this. We need to be able to be sustainable in such a way. It's an organization that we are building. So we have taken the recommendations. While we are going to get feedback, send out a survey, we are going to keep it running because our pride was that we're not going to miss an episode of the town hall. We'll make things better, but we would grow with it and make things better while running the organization. So I just want to thank Han for his input and that we actually are here to grow, and we are waiting for more volunteers to join the movement and join the change that we're doing. The good thing or the bad thing that we have not done in the town hall very much is to tell the town hall how much influence the town hall has had. Brian, I think so. Because there are times where multiple things have changed in Cameroon or have been created from the town hall. Just taking, I can't tell the number of things Brian has done, Kenji has done back home. Just after leaving the town hall, Kenji did a lot of changes. Each and every one of us, we have had policies. There is DACA in Cameroon today because of the town hall, which DACA has taken over $3 million in Cameroon. We have not talked about those things to change research in Cameroon. You guys don't know that. A lot of people here don't know that, but those are influences. How the Gate Foundation got to Cameroon was through Elvis. Multiple things. Bamenda Regional Hospital, we are running together with the wonderful director in the regional hospital, Tumor Board. With Bingo, we are changing lives there and people are getting better. So there are multiple steps that are going on. It's not directly, but people in the town hall have influenced it. And I have always said, I do not want to replace other organizations. You may try to do everything and end up doing nothing. You need to focus on what you do best. As Joshua said, you need to at times go back to the basics and focus on what you do best and continue doing it and being successful and sustainable before you go in and try to get to a larger audience. There are many organizations that we work with. Last week, I was with the American Association of Cameroonian Physicians in the United States. They do a lot. We can always partner with them. They had contacted me for partners when it comes to lectures at a certain time. I'm a member of that organization. The Cam Doctor UK, we have invited multiple of their members here to give us lectures. They invited me over to their organization too. I think about 2 weeks ago. They're doing wonderful things. The French doctors had contacted us. Germany, they had done multiple lectures. 2 of them had done lectures here. A lot of people don't know the town hall has been going for 3 years. And if you take 3 years, every other Saturday, you can imagine how many lectures have been given here and how many policy briefings have been done here. So it's super important to know that we will take in all the recommendations, Brian, would work on them, but we cannot go in and try to do things that we are unable, but we'll build this organization slowly and continue doing what we're doing best and build from there. That's my vision. But as we said, the town hall belongs to the people. We'll listen to everyone's vision and move forward.
Yeah, thanks a lot. I see that Khan has rejoined us, but I just wanted to take a moment to thank one person here in the town hall who has taken ownership of the idea to build a situational survey, or to build a situational analysis survey that will be sent out to the town hall. And I think these kinds of volunteerism initiatives that we are looking for, someone who can just take ownership of something and just run with it. So I just want to thank that person who reached out to us privately here, who is going to help us to build that. So thanks for that. And also, if there are other feedback, if you have expertise in something in particular that you think would be strategically helpful, I would also encourage you to reach out to us directly, and then we can try to make those happen. I see Khan is back. I don't know if you still had some additional comments to make, Khan.
Yeah, thank you so much, Brian, and apologies for the poor network. I am so happy with the response from Dr. Kane, and I will just wish all of us the best. Thank you.
Yeah, thanks a lot for the feedback that you shared, and those have been carefully noted. And you, as you heard from some of the remarks that Dr. Mono gave, he's very enthusiastic about really taking these comments to the next level. So thanks a lot for that feedback. I don't know if Dr. Polo, I see you, you're still here. Just wondering if you shared some really critical points as well in the chat, and just wanted to give you the opportunity to maybe share a few words from your experience where you are, Dr. Polo.
Thank you, Brian. Thank you, Dr. Mono. I want to thank all the organizer and all the volunteers who actually made this session possible. I just wanted to maybe repeat what others have said. And I'm glad Dr. Mono actually reminded us of what was the objective of this town hall. For me, it's my second session, so I don't have the history. I know that I'm just very humbled to have stumbled upon these opportunities to learn and also share. So I think focusing on the vertical that has been chosen, that this panel is very important. So being able to share how can we improve the healthcare state in Cameroon, sharing scientific advances, our knowledge is very important. I think there may be a temptation to actually branch out, which might perhaps dilute the objective. I think supporting those extra goals, which are in the ecosystem of supporting health in Cameroon, are still important, but really focusing and maybe going deep with the objective of sharing knowledge is, I think, is paramount if we want to keep this very, differentiate this initiative from other initiatives out there, other organizations. I'm going to speak about 4 things which have been mentioned before, so forgive me if I'm repeating what others have said, but I think it's very important. There was a question at the beginning, I think it's Brian, you actually shaped the question around how can we translate the scientific research and make it very palatable for the needs in the ground in Cameroon. So my comment was mostly around the reframing that question. I sense that, and I'm just going to give an example. Most of us know about CRISPR, the molecular scissors. So the first time the biologists actually, when they discovered it, I think it was in yeast, it didn't appear as useful for human health. And I think it's just years later that people start to think, how can we actually leverage what we found in yeast and now apply it to human diseases? So I think reframing the question that Brian posed at the beginning of how can we translate or make our science more focused on our needs and issue back home, I wanted to perhaps invite us to reframe it a little bit and take a step back and say, perhaps, should we not define the needs first? Maybe that's where we should start. And then when we have a collective sense on the need, we can have a basket of what science has been done, whatever science, whether it's applicable now or is not applicable, we can actually have that basket and try to do matching, literally. Because I'm fearing that we take the route of defining and limiting ourselves by what we know now, and we don't see the future. So I just wanted us to perhaps reflect on that as we think about how we can translate what we know. Brian has talked about his experience is next-gen sequencing. I'm a little biased because I've also, I did my degree in molecular biology, so I worked a lot in next-gen sequencing years ago. So maybe no one is doing this type of work now, but I can assure you it's going to come where other company, other people are going to come to Africa and then leverage that science and perhaps sell it back to us in health. So I think we should perhaps think about more broadly, what are the needs? And this actually brings me to my second point here, which is more around what somebody talked about earlier, is defining the needs, need assessment, or this situational survey. I wanted to perhaps look a little bit beyond the needs of whoever attending this panel. I think about the need of the healthcare ecosystem as a whole. There's a lot of knowledge shared in this session and past sessions, I'm sure, but how can we actually help people see how they can contribute? So is there a possibility, and I know there's a lot of time that has been put in making sure we have wonderful session. This is going to be perhaps more demanding on time for all the people involved. But I think really looking at showing use cases, a roadmap of the healthcare system and pinpoint where people across that ecosystem can help, can contribute. I'm sitting here, I have a medical background, but there are people who are in tech and they want to help. So if they come and learn about scientific subject or medical subject, they might not see how they can help, but they might be helpful. So if we sort of show them the way, they might, I think it might increase the impact of the knowledge sharing that we have in this forum. So the second piece, it's really about elevating the story. This forum is fantastic. This is my second session. I'm always learning a lot. And I think there is a sense of trust that Dr. Mono and Dr. Samuel and everyone involved has gained from the Minister of Health. I heard about what Dr. Samuel mentioned about the website that is going to be put in place. And it also reminded me of what an organization called African Diaspora Network in the US is doing. And one of the things that they found out is in Africa in general, if something is put out by the government, there is a resistance of, I will say, lack of trust from the diaspora, even from people inside. So because the organization here has already sort of built a status, why not use that to create awareness of what is going to be done in Cameroon in terms of building trust for what is coming and what has been done? So sharing the story, building the story, make it heard, I like what Brian is doing right now. I think taking snippet of these and translating in policy. I think we can also think about taking snippet of those sessions and make shorts in TikTok, on YouTube, for the general public. So something really attractive for people who are not in the medical field. So that's one consideration. And the last piece is really about how can we make sustainable the volunteership? Because without volunteer, I don't think this could go on. And many of you have already given a lot of your time over these 3 years. I can even imagine with family commitment and other things you have going on in your lives. But I also want to perhaps request that the panel actually consider. I know Dr. Mono has said he doesn't want anyone to be paid, and if I'm paraphrasing, my apology if this come the wrong way, but I wanted to basically also make sure that we don't lose the fact that people are attracted to something if they think they can win. People can like volunteering, they like science, okay? This is what they win, but other people have other incentives, other organizations. So why don't the panel look into this and see how it can basically look at the linkage between the pinpoint of some organization in order to drive sustainable volunteership. If an organization wants to talk about, I don't know, what they're doing, I think it makes sense also beyond the talk, the lectures, to also ask, maybe they can moderate, do 3 sessions of moderation, co-host, or plan the next session for the help to basically sort out the survey, the result of the survey. I think there needs to be an exchange to make the volunteership sustainable. Otherwise, I'm just fear you guys might be burned out. So those are my points. So thank you for giving me this opportunity to share my point. Thank you.
Yeah, thanks a lot, Dr. Polo. Again, very, very, very deeply insightful. I really appreciate your feedback. It was really great to connect with you from the previous session. And thanks a lot for all the excellent work that you do. This kind of feedback is really critically important, and I have noted those as well. I totally agree on the importance of conducting a needs assessment, and I hope that's one thing, as Dr. said, that we promise to do afterwards, after this. So we will certainly work on that and have a better sense of what the needs of the health ecosystem is, and take it from there. So thanks a lot. I just want to take a closing round with the some of the moderators who are here. And Dr. Mona, I see Elvis and Kathy. Mona, I really want to thank you. I know you left you're in the middle of a wedding and you're the best man in the wedding, and you were still able to squeeze out time to be here. So thanks a lot. That really speaks volume to your commitment to this initiative. So thanks a lot. So I want to take a closing round with the moderator, with Kathy and Dr. Elvis, please.
Yeah, thank you, Brian. And yes, this is all about, giving our time. And I think Mona has always emphasized that point, that the Cameroon Town Hall belongs to all of us. And I think right from the onset, we've had proposals and to do other things. And one of the key things that was always said was we need to stay focused on what we are doing and allow other organizations do other things. But I believe the town hall is growing, and we, at some point, we would be considering, adding into our basket some of the things that are tightly linked to what we are doing, and only what we are able to accomplish while being stable, I believe, and allow and continue to work with other organizations, even as Dr. Paulo was saying, to be able to achieve everything. No one organization can solve all the health problems in Cameroon. it has to be a multiplicity of efforts, multifaceted efforts coming from every corner to be able to achieve that kind of utopia which we dream of in terms of the health sector in Cameroon. So I just really want to say really wonderful discussions today. I believe there are so many things that we as moderators, we are going to take back to think about and to chew, ruminate, and probably bring back to the town hall, make some adjustments, build some speed so that we see some really great achievements. I'll end there. As you can hear, I'm on further duties as well. So thank you.
Thanks a lot, Kate, and thanks a lot for your commitment as well. Elvis. Yeah, looks like we may have missed him. I don't know if Dr. Samuel has any other closing thoughts and remarks from this discussion. Dr. Samuel.
Thank you very much, Brian. I want to again thank all the participants. I think the feedback that we've had is actually going to help shape as we move forward what we are doing. And I think the contribution from everyone, just like the chair said, is helping us. When you are doing something and nobody is actually there to criticize or to tell you, you see things only the way you want it to be. And I just wanted to say we really appreciate all the feedback. And also to add that for those who are new to the town hall, we do have, you can always send in suggestions, you can send in any information you have. Brian, I don't know if we have the link, any other suggestions that you have that we were not able to, or you were not able to have the opportunity to present it. Know that the town hall is open, as the chair already said. And I just wanted to thank you for an excellent job moderating and coordinating.
Yeah, thanks a lot. Thank you very much. Appreciate the feedback, Dr. Samuel. I don't know if Elvis is still on. Elvis, are you still on? Okay. All right. So I just want to turn into Dr. Mono, maybe for his closing thoughts and his closing remarks, and also thanks a lot, Mono, for your leadership and for making this sustaining this for the last almost 3 years now. So thanks a lot. I know how charged you are, and I really understand some of the many commitments that you have, and your dedication to this has really speaks volumes. So I really want to really thank you for everything that we really learned from you, and I think you've really modeled what visionary leadership and persistence really and consistency really represents. So thanks. I just wanted to give you maybe to give some closing remarks from this session today. Over to you, Doctor.
Yeah, Brian, thank you. And I wish my brother doesn't kill me after this for participating in his wedding and leaving a little bit during the picture bumping sessions. And I'm going to go back directly to that. And he took me to Hot Springs in Arkansas, so just close to a place called, just close there. So what I want to say is by thanking those who have volunteered from the beginning of this. We had one volunteer today from Jude Zafar, which I want to call his name. I want to thank you for volunteering your time. Cameroon, we need more people who are going to volunteer into things that, I don't want you to volunteer into the town hall, things that drive your passion. That's true commitment to change. And I will not pretend that this whole session was, oh, this town hall is about me. No, it's about the Cameroonian people. I want to thank the multiple, more than 3,000 Cameroonians who have participated in 1 or 2 sessions. The strange thing, which I always said to Brian, is that the numbers keep staying the same. People may be different, but the numbers keep staying the same, showing that people have interest. I want to particularly thank the moderators here today, Dr. Kate, Dr. Brian, and Elvis. I pushed this idea with Elvis multiple times, 3 years back or more than 3 years back. We played with it like ping pong. I also want to thank those who are not here today who have been moderators, like Allison, for her wonderful leadership at the beginning of all of this, how this all started, for Teresa, for Luisa, and also we all really want to thank everyone who has been here one way or the other. Christelle, who did wonderful moderation for us in French. And I want to say that the town hall is open to people volunteering. One thing the town hall has done is been very humble in telling the success stories of things that have gone through this town hall. But I can tell you, without any kind of regret, that this has been one of the most influential things I've ever found myself in. We did make the Minister of Public Health to sign a decree in place, signed by the Prime Minister, creating a diaspora forum. That to itself is huge. We, through the town hall, Elvis, the Dakar project, which had to go to some other country in West Africa, went to Cameroon. Millions of dollars went to Cameroon. It was not one thing. Just to name a few. I know a lot of people here asking, what have we done? We have done a lot. If you sit in the chair where I sit every day, we have made calls where people could not open up health centers in Cameroon, and they did open it because of the town hall and the diaspora influence. Multiple influence coming out of the town hall, but it's not, at times is, you don't have to come in, you want to always keep making change, and you want to always keep progressing. That's why we're here today to talk about the things that we can change. We have listened to you all. You can keep sending your suggestions. There is the Give Back project that we have not talked about. We are urging everyone in the diaspora, think about something small. It could be you want to do lectures on colon cancer. You want to do lectures on congestive heart failure. You want to go to Boya or to Yaoundé and teach the students how to interpret EKG. You want to open an EKG school for a month with the different medical student groups, those from Boya, those from Yaoundé, Kamesa, any of them. And I want to encourage these students to also participate in the town hall, because if they don't come in, there's a lot for them to learn. And we cannot sit in the diaspora and just sit there. They need to show us that they want to learn. I know their former Secretary General is here. Someone I've communicated with 1 or 2 times. Your mates need to show that they want to learn. There is a lot. We have passion. Some of us have passion for some of those organizations you guys belong to. But you guys need to show interest in what you want to learn. You need to show that you're enthusiastic about things. We cannot keep giving to other, this is an aside, to organizations, student organizations, when there is no passion. There is no enthusiasm. So it needs to be a traffic wave from both sides. So I've listened to nursing organization, medical student organization, different groups back home. We need to show that we are committed to change. We want change back home, and we should be the change we want. There is a time in a nation, what has your nation done to you, and what have you done for your nation? That's how we should be interpreting both ways. So I want to thank everyone who is here today. I may not be there for the parking lot because I have to go soon. And wish you all the best in the next 2 weeks. As Dr. Dieter said, I'm taking all his advice. We need to start organizing and letting you all know exactly what is coming next, what we are going to do. We are not going to halt the sessions, but we will continue, as Kat said, reflecting on improving. sending out a survey, getting your input. We did send a survey almost 2 years ago asking if we should convert this to every month. And totally everyone refused in the survey. You would not believe that. I was shocked because I also wanted to liberate myself from these duties. But they told us that we should go every other. So we're going to do that again. So Brian, thank you. Thank you everyone for being here. It was a wonderful session as always, and thanks to all the moderators and thanks to everyone who commits their time to be at the town hall.
Yeah, Mono, thanks a lot again for your leadership, and thanks a lot for your dedication to this course. So